So the vision behind All for Them was to actually get parents the information that they need to be able to get their kids vaccinated, and primarily for HPV vaccination because they're already getting their other vaccines. However, we also recognize that some parents don't have access to vaccination, and so making vaccination overall accessible as well.
All for Them is unique in that we are using a multi-level and multi-component approach to increase HPV vaccination among young people. We are implementing 3 evidence-based strategies to accomplish that goal, and we're implementing them at different levels with parents, students, schools, and the community. And the different strategies we're using include a social marketing and educational campaign aimed at parents primarily, and actually now older high school students as well, now that we've expanded into different student populations. We're also implementing free, comprehensive, pre-consented vaccination clinics in schools. And what that means is that parents provide consent for their children to get the vaccines that they need on campus in advance, which is a great opportunity for them. And we are also doing some continuing nursing education around HPV vaccine to bolster nurses' understanding and their professional practice around HPV vaccination. We're hoping to reach parents and students that have been left out of the conversation in the past around immunizations and HPV vaccine in particular. We're also trying to make sure that they have access to receive these life-saving immunizations and make it, easier than it has been for them. And one of the most important things that we're working on is normalizing HPV vaccination as part of routine adolescent healthcare, because it is. And it's really important to us that parents and their students understand that.
This is a passion project. Being able to actually prevent cancer for people is something that we haven't been able to do in our lifetime. And so to be able to see this and know that there's somebody in this group of young people that are getting vaccinated that won't have a cancer in the future because of this, that's really exciting to me.
We have vaccine hesitant parents in most communities that we go out. And so a lot of the time we like to be where the parent is and empower them to make that decision. So we like to first ask what their concerns are and address them. So a lot of the time when we've done that, we have been able to have some parents, after they've asked questions, they've been able to change their mind on the spot about initiating their HPV vaccine series for their child. So that's been really rewarding to see.
Our community, the parents, some of them are working long hours. They leave home in the morning and they get back late in the evening. So most of the clinics are closed, and so they are having a hard time to go get it. And also the money, the parents don't have to be here when they're getting the vaccines. Parents can complete the form. And so it was a good success. I'm putting more emphasis on, we do need the second dose, you did one. So it's really helping, and for the kids to be knowing and the parents to be aware of the HPV vaccine, it kind of helped,
We are coming into the school, the child is only missing maybe 20-30 minutes of class, and the parent doesn't have to miss any work, or they don't have to find childcare for the other children, they don't have to find a bus ride, they don't have to find a ride from a friend. We're doing all of that for them. There have been studies to show that school-located vaccination programs, which are what this program is, are very beneficial to the families. We never had the social media piece and the collaboration with the school nurses in the way that this All for Them team can do and has been doing now for many, many years.
We really have a special partnership between UTHealth and the University of North Texas Health Science Center, UNTHSC, that's been able to bring the All for Them program using their evidence-based strategies of putting vaccines in schools where people are located and kiddos are located to get the vaccine, and bring that to Fort Worth and Crowley. This is in a region of Texas where we've had lower rates of HPV vaccine uptake, and we really have the opportunity to bring cancer prevention to kids who otherwise wouldn't have that available to them.
CPRIT has just been such a critical mover of this project, right? It's like they've given us the resources to put prevention into action, and that's so incredible. In the future, what we would really love to see is for school districts, schools, and providers to take All for Them and run with it.
We want school districts to take ownership of All for Them, to tailor it in a way that works for them while also retaining the core components that we have found to be effective. That's something that we're really looking forward to. It has truly been an honor to bring All for Them and our approach to adolescent immunizations to multiple school districts across the state, and we hope that we have the opportunity to continue to grow that impact. It has been really, really exciting.